Depression is a growing concern among patients. It occurs in all patient populations, not only those in a psychiatric setting. It is very important in all settings that we assess our patients not only for their physical concerns, but their mental concerns. The National Patient Safety Goals advocated by the Joint Commission now include suicide prevention. There are a few simple questions you can use to help assess your patient for risk of suicide. It's very important when you ask these questions that you state them simply and are very non-judgmental. You need to be matter-of-fact and straightforward with your patient. It's best to start with a lead-in question, such as their current stressors. What kind of things have they recently or are currently experiencing that are adding stress to their life? The more stressors they identify, the greater their risk. Once you've identified potential stressors, ask them if they've ever had problems in the past with thoughts or attempts of harm. Research shows that for every previous attempt, your risk of a successful future attempt escalates. The next question is the most important. Are they having any current thoughts of hurting themselves or killing themselves? Whichever term you feel more comfortable using. If they say yes, they have had such thoughts, ask them if they have them constantly or do they come and go. Then you need to see if they will share with you if they have a plan for how they would do that. The evidence of a plan greatly increases their risk. If they will share their plan, you need to evaluate that plan. Is it lethal? There's a significant difference between saying, I might take 5 Benadryl, or I know where my dad's gun is and I'm going to use it to shoot myself. So see how lethal the plan is, and do they have access to that plan? Are the medicines where they can get to them? Is there a gun in their home or nearby where they can find it? Those are significant questions if a patient has a plan. Once you've assessed that they might be at risk for suicide, look for additional risk factors that can increase that risk. Do they have cognitive impairments? If their thought processes are altered, they're less likely to think through the consequences of their actions and truly hurt themselves. Do they have issues with poor impulse control? They shared those stressors with you. Do they have ways to cope with those? Do they have a support system? If the answer to those questions are no, their risk factor increases. Substance use is another significant risk factor because it impacts those things, your cognitive ability, your impulse control, so to add that in to your concerns. It's important to assess this on an ongoing basis with your patients. Once you've identified that a patient might be at risk, you need to follow through like you would with any other abnormal finding. Contact the physician and together develop a plan of safety care for your patient. So remember, all patients are at risk for depression, and suicide is a growing concern. Take the time to assess your patient for both their physical and mental concerns.